Yeah, thanks, Ceann Comhairle. Before I speak today, I'd just like to acknowledge the work of former Deputy John Brazel in regard to the introduction of this bill. And this bill is essentially a reintroduction of that work that John Brazel undertook a few years ago. I'd also like to acknowledge that the Health Minister is here today, and just to acknowledge that he did make an extra €50 million available in the drugs budget in the last year, and that's also to be commended. Ceann Comhairle, under the current Act, there is no differentiation between orphan medicinal products and other products in Ireland. In recent years, it has become clear that there is an issue in Ireland whereby orphan drugs continually struggle to secure reimbursement, often despite their wide availability elsewhere in Europe. Indeed, it is well acknowledged that Ireland is a laggard behind countries like Romania, Hungary and other Eastern European countries in the provision of these drugs. This reimbursement process is protracted, unnecessarily public and often antagonistic, with patients continually forced to protest publicly or engage with politicians to seek fairness and equity over the course of a 2-year campaign from initial application in Ireland to a final decision. And I was just listening there under promised legislation, Deputy Griffin and previously Deputy O'Sullivan from West Cork mentioned the plight of the people seeking Zolgensma for approval, and unfortunately those families have the same journey to undertake as did the sufferers of amyloidosis who recently got the approval for the patisiran drug only in the last couple of months. And unfortunately that long journey awaits many of these families. The issue of low availability of orphan drugs or treatments specifically designated for rare diseases is complex, with several factors contributing to the problem, ranging from the appropriateness of the assessment mechanism, the current framework agreement between the state and pharma industry, and industry pricing and prioritisation in Ireland. This bill is not a panacea to this complex issue, but looks to address one of the clear barriers to access in Ireland in how we apply a standardised assessment mechanism to medicines that are far from standard. Presently, the same health technology assessment is carried out by the National Centre for Pharmacoeconomics for new medicines, irrespective of their medicine type. This is a quality-based health technology assessment whereby quantitative data on the medicine and the disease it treats are used to assess its cost-effectiveness. In Ireland's case, this threshold is set at €45,000 per qualy. This mechanism presents several issues for orphan drugs which often possess limited quantitative data due to the low clinical data or the low epidemiology around a rare disease, given such a small patient population. As such, a quality-based health technology assessment will result in huge uncertainty around an orphan drug. In the words of Professor Michael Barry, head of the NCPE, before a previous health committee, none of the drugs for rare diseases will reach the €45,000 per quality threshold. So at present, the current system is designed for orphan drugs to fail. The consequence of using this form of health technology assessment, therefore, is that commercial negotiations between the state and industry commence from a poor position, whereby the information available to the HSE is of limited value. This is directly contributing to the 2-year process of protracted negotiations as both parties seek to reach a fair and accurate agreement of the true value of medicine. And now just to speak to the bill itself. Responsibility for addressing the issue has fallen between two stools at present, with previous health ministers stating at every opportunity that statutory responsibility for medicine pricing and reimbursement decision lies with the HSE in accordance with the Health Pricing and Supply of Medical Goods Act 2013. The HSE, for their part, have informed members of this House through health committees that the 2013 Act does not make separate provision for orphan drugs, and as a result, the processes and procedures do not make separate provision for distinct criteria on the assessment of orphan drugs. When challenged on whether the HSE had any flexibility under the Act to allow for a tailored approach to assessing orphan drugs, the HSE previously stated that we have pushed the legislation as far as we can. This bill therefore seeks to resolve this issue by clarifying for the HSE the application of the health technology assessment for assessing orphan drugs, as well as establishing a set criteria to be considered when making a relevant decision on the reimbursement of an orphan drug. It clarifies that the HSE, when carrying out a HTA, should do so in a manner that does not rely on incremental cost-effectiveness ratio threshold, but instead conduct a HTA that will provide a meaningful and credible assessment of an orphan drug. This is not to suggest we do not carefully consider an orphan drug, but that we look to EU member states like Sweden that have adopted their HTA in such a manner. Just to finish, I suppose the hardest thing I've had to do since I was elected was sit across a kitchen table where, one of the families that have been seeking approval for orphan drugs, and I suppose to hear their own individual story and to be told that if they're not going to get medicine or a tablet by a certain date, then they undoubtedly will either die or suffer from severe medical trauma or whatever the case may be. And this bill, despite John Brazel's previous attempts, is costed, as in there is budgetary constraints on it. We're not asking for a magic money tree here to provide medicines for these people. We're just asking that orphan drugs that very few people in this country suffer from, by their nature, they're rare diseases, that they would be given the same assessment on qualitative data as other drugs do. And I'd just like to raise this in the Dáil this evening. Thank you.
Thank you.